discuss two clinical scenario quickly. So in the first scenario we have a female, and in the second scenario we have the male. So the first scenario where we have a female, the female is of 40 to 60 years, and the female has anti-mitochondrial antibody positive in most of the cases, whereas here we have a male who is 30 to 50 years, who is most of the time anti-mitochondrial antibody negative but is PNK positive. Okay, now we'll focus on this woman who is anti-mitochondrial antibody positive. She shows that she has intrahepatic biliary duct atresia or obstruction. Okay, that is involving only intrahepatic bile duct. Also we see that this female not only has involvement of intrahepatic bile duct and disease involving it, she has number of autoimmune diseases. These number of autoimmune diseases include rheumatoid arthritis, Sjogren syndrome, Hashimoto's thyroiditis, and CREST syndrome. Okay, and when we do biopsy in such a patient, which is also the diagnostic method in this case, we see florid duct lesions. And on long term, this patient is going to develop cirrhosis. Whereas when we talk about this another guy who had PNK positive, this patient liver had intrahepatic as well as extrahepatic bile duct atresia or obstruction. So here we had only intra, here we have extra and intra, and only autoimmune disease we saw in this patients were ulcerative colitis. Also here diagnosis is made by MRCP. We see the florid, we see the duct lesion intra and extrahepatic, no florid duct lesion in this case. We have the diagnostic method here as MRCP, but on biopsy we are going to see onion skin appearance. Okay, also in this case the long-term complication can be cirrhosis and cholangiocarcinoma. So here we are talking about two conditions, that is primary biliary cirrhosis and primary sclerosing cholangitis. Primary biliary cirrhosis, a female with anti-mitochondrial antibody positivity with intrahepatic bile duct lesions with number of autoimmune diseases, is going to present in biopsy as florid duct lesion which are granuloma, and cirrhosis is long-term complication. Whereas the male 30 to 50 year with no mitochondrial antibodies but PNK positivity, intra and extrahepatic bile duct involvement with only ulcerative colitis as autoimmune disease, can show MRCP intra and extrahepatic bile duct involvement. Biopsy will show onion skin appearance, and long-term patient can develop cirrhosis and cholangiocarcinoma.